Hi everybody, Dr. Suneel DHAND, internal medicine physician. Firstly, I wanted to start off by saying once again a big thank you for all of the kind messages of support I received following my video a couple of days ago. I really appreciate them. I wanted to talk today about my own experiences working on COVID units, especially over the last couple of weeks, because in between making these videos, I do actually work in a hospital, actually a couple of different hospitals. Since the beginning of this pandemic, I have worked in 4 different COVID units over the last 18 months. I've treated hundreds of COVID-19 patients. And I do think that as a society, we should be hearing more from many of the frontline doctors like myself, who are actually there at the front lines. And the problem that I have right now is that many of these TV pundits, these so-called experts, haven't actually been treating COVID-19 patients, yet they are very influential indeed. But it's always good to have a frontline perspective. Obviously, I can only give you my own experiences. I'm one doctor working in one region of the country, and I'm in one specialty. Every physician will have their own different perspectives of this pandemic since the very beginning. But here we go then. I want to go over with you exactly what I have seen over the last couple of weeks working in 2 different COVID units. The first thing to say is that we as the medical community have got so much better at treating COVID-19 over the last 18 months compared to where we once were. When I look back and think to myself, what was the biggest game changer in terms of treatments? Now, I'm giving you the perspective of a hospital medicine physician thinking about hospitalized patients. Obviously, most patients with COVID-19 recover at home. It's a small percentage who end up in the hospital. And those that do usually come in because they're feeling more short of breath. They have low oxygen levels, what we call hypoxia. And I would say that the one treatment that appears to have been most beneficial is simply giving our patients steroids. Around the spring of 2020, some evidence started coming out saying that steroids were highly beneficial in patients with COVID-19, and we weren't previously routinely giving steroids, and then we started giving steroids more. And what's really interesting is the fact that steroids are very cheap. They've been around for a long time. The particular steroid that we've been using is dexamethasone. We have been administering more cutting-edge treatments as well, like remdesivir, antibody treatments, but in my opinion, steroids have been the biggest game changer, and we give all of our hospitalized patients who have low oxygen levels a course of steroids. A lot of doctors actually will remember from their time in medical school, there's a famous phrase that I remember my old school professors telling me: you should never let a patient die without giving them steroids. If you've thrown everything else at a patient and nothing has worked in the hospital, try out steroids, because they can frequently be a remarkable medication in many different conditions. And I find it very interesting that this cheap, very old medication has proved to be very beneficial for COVID-19 patients, and we weren't using steroids routinely right at the beginning of the pandemic. So patients overall are doing much better now than they were 18 months ago, and that's not solely because of steroids. Don't get me wrong, there's other treatments as well. We as a medical community are more used to treating COVID-19 and going through protocols in the hospital. But I would say that over the last couple of weeks then that I've been working in different COVID units, I know a lot of people's first question is, what are the unvaccinated versus vaccinated percentages that you are seeing? And I have treated both unvaccinated and vaccinated patients for COVID-19, what we call breakthrough cases in the vaccinated group. However, the percentage of unvaccinated coming into the hospital is higher than what would be expected given the local vaccination rates. As you can see here, the data suggests over the last few weeks that the percentage vaccinated coming into the hospital has been between 25 to 30%. In other words, there is a higher proportion of unvaccinated patients coming into the hospital than would be expected. Overwhelmingly, the patients do belong to the high-risk groups that I've talked about so many other times in my videos. The 3 big ones: elderly population. Number 2 would be anyone with comorbidities, especially diabetes, lung disease, but there are other medical conditions as well. And number 3, anyone who is overweight or obese, because it is scientifically proven that having excess body fat is a very significant immune suppressant and also places an unnatural stress on the lungs in times of need. So these 3 high-risk groups in particular are what I have been seeing over the last 18 months and have been confirmed with my stints over the last couple of weeks as well. Remember, we are talking about anything which can potentially compromise your immune system. And that's why, with regards to these risk groups, and if we come back to vaccinations again, my concern is that there are many people out there who are still in these high risk groups remaining unvaccinated. And if you or you know anyone out there who is in these risk groups, elderly, comorbidities, those who are obese, please encourage them to strongly consider vaccination. And the reason is very simple. If we look at any medical intervention in terms of a benefit versus risk decision, having a risk factor for immunocompromise and increased risk of severe COVID-19 infection tips the balance so far towards the benefits of vaccination outweighing any potential risks or side effects of the vaccine. And I am not one to tell people what to do or dispense medical advice directly in my videos. I always say, even if you're on the fence or have questions, please speak to your own physician, because that's what it should always be about, a conversation between a doctor and a patient. But those are my thoughts. I can only do my best to guide you. But I have been seeing since the very beginning of the pandemic very defined high-risk groups who are consistently coming into the hospital. 3 other things that I would like to note from my experiences are: number 1, there are more males than females being hospitalized with COVID-19. We've witnessed this since the beginning of the pandemic, and it still holds true. Although the numbers of females are not insignificant, there are still more males than females. Number 2, I want to stress again that many of the poorest communities are being hit hardest by COVID-19, even during this current wave. And number 3, I cannot stress enough again how many of my patients had underlying lung disease, diabetes, and obesity. Overall, I would say that my experiences over the last couple of weeks have suggested that because of our treatment protocols, COVID-19 patients are doing much better, which is a good thing. And I'd like to come back again, as I've mentioned in previous videos, to the importance of the next few months. The winter is going to be absolutely crucial, and as a society, I would like us to stay razor sharp focused on these higher risk groups. I believe a mistake we've made, actually I think we've made a lot of mistakes in our COVID-19 strategy all across the world, but I think one of the biggest in Western countries is if you take a step back and you think, as a society, we have spent far more time and resources on how to protect younger people, including children, and efforts to close schools, etc. And I'm not going to get into a debate about the merits of those particular strategies, but I will say, if we think as a society that we have spent so much time focusing on children and young adults instead of where it should be the other way around. We should be spending more time on protecting vulnerable groups, especially the elderly, those who are living alone, those in nursing homes, etc. That's what I would really like us to do over the next few months. We have to be about getting the most help to these groups. Thanks everyone for listening. On that note, I am working again in the hospital this weekend. I hope none of you are working. I hope you get out, get to enjoy yourselves. Have a great weekend. We'll speak again very soon. Dr. Suneel DHAND, MedStoic Lifestyle Medicine. Thank you for listening.